Hello friends, let's see the portocaval anastomosis. Before going into detail of the anastomosis between the portal vein and the cable system, that is the inferior vena cava system, the anastomosis between the two, let's move on to see the portal vein, how the portal vein is going to form. This portal vein, it is responsible for carrying the blood from the gastrointestinal tract, except from the lower part of the rectum and the anal canal. Along with the gastrointestinal tract, this portal vein also drain the blood from the pancreas, gallbladder, as well as the spleen. So where does exactly this portal vein is going to form? Portal vein forms just behind the neck of the pancreas by the fusion of the splenic vein and the superior mesenteric vein. This portal vein, after the commencement just behind the neck of the pancreas, it passes upward and it runs behind the first part of the duodenum, and it further passes upward to reach up to the porta hepatis, where it divides into the right branch and the left branch. This right and left branch of the portal vein, they reach up to the liver and they are going to run within the portal canal situated within the liver, and through the portal canal the blood is going to drain into the hepatic sinusoids. These hepatic sinusoids, they are going to drain into the central vein and ultimately going to form the right and left hepatic vein that drain into the inferior vena cava. So this is the circulation of the portal system. So when we see the portal vein is going to form the tributaries from the intestine as well as the spleen, pancreas and gallbladder. They are going to form a single trunk of the portal vein by the fusion of the splenic vein and the superior mesenteric vein. As the superior mesenteric and the splenic vein, they fuse to form the portal vein just behind the neck of the pancreas. It passes upward behind the first part of the duodenum and reach up to the porta hepatis of the liver. And at the porta hepatis of the liver, it is going to divide into right and left branch of the portal vein. And this right and left branch of the portal vein, that divides into the sinusoids, and they are going to form the central vein. The central veins, they are fused to form the hepatic vein, and these hepatic veins, they are ultimately going to drain into inferior vena cava. When we see the splenic vein, it also receives the inferior mesenteric vein. When we talk about the tributaries of the portal vein, the superior mesenteric vein and the splenic vein both are the formative tributaries of the portal vein. When we see the other tributaries of the portal vein, the left gastric vein and the right gastric vein both are the tributaries of the portal vein, directly draining into the trunk of the portal vein. One tributary that is receiving the blood from the gallbladder, and that is the cystic vein, which is going to drain into the right branch of the portal vein. And one more branch, that is the para-umbilical vein, it passes through the umbilicus and runs within the lower margin of the falciform ligament, which is going to drain into the left branch of the portal vein. So all these are the main tributaries of the portal vein. Some occasional tributaries, they are the prepyloric vein of Mayo may drain into the portal vein. Some right gastroepiploic vein also draining into the portal vein, as well as sometimes the inferior mesenteric vein, in spite of draining into the splenic vein, directly drain into the portal vein. So these are all about the tributaries of the portal vein. According to the course of the portal vein, the portal vein can be divided into two parts. The part which is situated below the liver, that is intrahepatic part, and the part of the portal vein within the liver, that is intrahepatic part. Now this extrahepatic part is further divided into three parts. The part which is situated below the duodenum, that is called as the infraduodenal part. The part of the portal vein situated behind the first part of the duodenum, that is the retroduodenal part, and the part of the portal vein which is situated above the first part of the duodenum, that is called as the supraduodenal part. And when we see the intrahepatic part, as we have already discussed, this intrahepatic part, it is going to divide into the hepatic sinusoids. These hepatic sinusoids, they carry the blood to the central vein, and the central vein carry the blood to the right and left hepatic vein, and this right and left hepatic vein ultimately drain into the inferior vena cava. So this is the portal system, the part of the portal vein. Now, when we see the peculiarities, there are some very important peculiarities of the portal vein are there. This portal vein is valveless, as this portal vein is going to start as the veins from the gastrointestinal tract as well as the spleen, pancreas and the gallbladder, and they form the trunk of the portal vein, and after formation of the trunk of the portal vein they divide as the arteries inside the liver as the hepatic sinusoids. So there are two sets of the capillaries are present within the portal vein. This portal vein is devoid of valves, so no valves are present within the portal vein. This portal vein acts as the reservoir of the blood. Around one-third of the total amount of the blood inside the body is stored in this portal vein. The important thing to understand is that within this portal vein there are two streams of the blood are there. On the right side, the superior mesenteric vein it passes, and on the left side, the splenic vein blood is going to pass. So there are two streams of the blood are present within the portal vein. So these are the important peculiarities of the portal vein. Now let's move on to the most important part of this lecture, that is the portocaval anastomosis. So when we see the portocaval anastomosis, the first site of the anastomosis between the portal system and the caval system is at the lower end of the esophagus. So at the lower end of the esophagus, the portal vein and the systemic vein, they are going to get anastomosed. So let's see how the anastomosis between the portal and the caval system at the lower end of the esophagus occur. So at the lower end of the esophagus, some tributaries they are going to drain into the left gastric vein, which is ultimately going to drain into the trunk of the portal vein. And along with that, some tributaries they are going to drain into the hemiazygos vein, which is a systemic vein. So the anastomosis between the tributaries of the left gastric and the tributaries of the hemiazygos is the site for the portocaval anastomosis. In case of the portal obstruction, the engorgement of the veins at the lower end of the esophagus occur, and sometimes the wall of this vein may get rupture, and that will lead to the severe bleeding. And this bleeding may cause the vomiting of the blood, and that is called as the hematemesis. And this engorgement or the dilatation of the vein at the lower end of the esophagus at the time of the portal obstruction is called as the esophageal varices. Now, when we see the second site where the portocaval anastomosis is present, it is at the level of the lower end of the rectum and the anal canal. This inferior mesenteric vein, it is going to carry the blood from the superior rectal vein. So the superior rectal vein is going to ultimately drain into the portal system via this inferior mesenteric vein, while at the level of the pectinate line, the lower part of the anal canal below the pectinate line is going to drain into the inferior rectal veins. So these inferior rectal veins, they are going to ultimately drain into the internal pudendal vein and going to drain into the vena cava system. So this is the site where the portal and the systemic anastomosis occur. In case of the portal hypertension, this portosystemic anastomosis veins are getting engorged and sometimes the bleeding may occur, and this is called as the internal piles. or it is also called as internal hemorrhoids. The bleeding from the anus that is painless, it is one of the important symptoms of these internal hemorrhoids. The third site of the portocaval anastomosis is at the level of the umbilicus. From the umbilicus, the para-umbilical vein is going to drain and passes under the falciform ligament, and through the falciform ligament it reaches up to the liver and going to drain into the left branch of this portal vein. And from the superficial aspect, the umbilicus, the area around the umbilicus is going to be drained by the systemic veins, and these nearby systemic veins are the superior epigastric veins, inferior epigastric veins, posterior intercostal veins, lumbar veins, as well as the superficial epigastric vein. So all these systemic veins, they are going to anastomose with the para-umbilical vein at the umbilicus, and that's why this is the site of the portocaval anastomosis. In case of the portal hypertension, this portocaval anastomosis around the umbilicus, they get engorged and they get affect. And because of the affection of this portocaval anastomosis near the umbilicus, in case of the portal hypertension, we can see that the veins around the umbilicus, they becomes dilated and engorged. And this dilated and engorged vein from around the umbilicus, they are called as the caput medusae. So this is the sign of the liver cirrhosis, or in case of the portal hypertension. The fourth site of the portocaval anastomosis, it is just behind the peritoneum. Just behind the peritoneum, this left renal vein having tributaries which get anastomosed with the tributaries of the splenic vein as well as the tributaries of this colic vein. So this anastomosis, it is also one of the portocaval anastomosis. The vein which communicate between the splenic vein and the left renal vein, it is called as the vein of Retzius. The fifth type of the portocaval anastomosis, it is present at the bare area of the liver. So when we see this bare area of the liver, the some part of this bare area of the liver having tributaries which are going to drain into the diaphragmatic veins. And these diaphragmatic veins having communication with the hepatic radicals of the portal vein. So the hepatic sinusoids, they are getting communicate with this diaphragmatic vein and going to form the portocaval anastomosis. The sixth area where we find the portocaval anastomosis, it is within this falciform ligament of the liver. So at the site of this falciform ligament of the liver, the small veins draining from this para-umbilical vein, they get anastomosed with the diaphragmatic veins which are situated nearby it. And this anastomosis, it is also the portocaval anastomosis. And the small veins from the para-umbilical vein, they are called as the accessory portal system of SEPI. And the seventh, portocaval anastomosis, it is sometime present in the normal individual. In case of the fetal life or in case of the intraembryonic life, a channel which is going to communicate between the left branch of this portal vein and the inferior vena cava is called as the ductus venosus. But in case of the adult life, after the birth, this ductus venosus is going to get fibrosed, and now it is called as the ligamentum venosum. So when in case of the adult life, if this ligamentum venosum do not get fibrosed and it remains patent, this is also one of the site of the anastomosis between the portal vein and the systemic vein, that is between the left branch of the portal vein and the inferior vena cava. So these are the seven sites where the portocaval anastomosis are present in the body. Now, after understanding this portocaval anastomosis at the different sites of the body, we have to understand the clinical importance of this portocaval anastomosis. When we see the clinical importance of this portocaval anastomosis at the time of the portal hypertension or at the time of the portal obstruction, that will lead to the backflow of the blood within the portal system. That backflow of the blood within the portal system that will lead to the accumulation of the fluid within the peritoneal cavity, and that is called as the ascites. So ascites is one of the symptom of the portal hypertension. In case of the few individuals, when this portal hypertension is there, that will lead to the increase in the pressure of the portocaval anastomosis at the site of the lower end of the esophagus or at the lower end of the rectum and anal canal, and that will lead to the rupture of the veins and may lead to the esophageal varices or internal hemorrhoids. So this is all about the portocaval anastomosis. Hope you understand well. Thanks for watching.